Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to be here with Dr. Meagan Smith, pediatrician that just joined our staff, and thank you for coming this morning.
Yeah, I really do appreciate y'all having me. It's a pleasure.
Tell us a little bit about where you're from and a little bit about your medical school, residency training, and so forth.
Yeah, so I'm originally from a small town in Mississippi. Grew up there, went to undergraduate at the University of Southern Mississippi in Hattiesburg, Mississippi, which is a town very similar to Thibodaux, with Nicholls State being here. So it feels kind of like home already. And so after that, I moved to Jackson to do my medical school training at the University of Mississippi Medical Center. From there, I was kind of at a turning point in my life, and I was like, I just had my first son, and I was like, I think I wanted to do family medicine. So I matched into family medicine, realized that this wasn't what I wanted to do and that my true passion was taking care of kids. I wanted to do that full time. And I knew if I stayed in family, I wouldn't get that opportunity. So I went back into the match, and then I rematched into pediatrics at Arkansas Children's Hospital. So I did my training there. I went on to get board certified through the American Academy of Pediatrics, and then went out and started doing training in the community in Arkansas, Alabama, and now here in Louisiana.
Great. I like your accent, sister. It's nice.
It is a little thick, isn't it? No, it's a very much Mississippi accent.
I lived in Arkansas for several years. And yeah. Well, look, that's all good training, and it's interesting that you moved over to pediatrics after having been in the training program for family doctors. That shows you're really thought about it, and you're pursuing what's in your heart, in my opinion. And
while in medical school, you don't really see the opportunities that are out there in the community. When I got into family medicine residency, I was working with some private practice pediatricians, and that is what sold me on pediatrics. The bond that they had with their patients, they got to follow them, as they grow up, and that they were really just so involved in the community. Plus, me and my husband have 2 kids of our own, so we're already involved with the school systems and things like that. So, it's just a great opportunity and a pleasure to be able to take care of those kids that your children are friends with, and that you're involved with.
Great, it's awesome. The whole social and educational and so forth experience. Well, look, the pediatricians can leave a definite positive impression upon children, and they remember them the rest of their lives.
It really is. It's a lifelong, lasting relationship that you build with these families, and you get the opportunity to be there from the very beginning. The minute the child's born, you get to watch them grow, develop, change over time, and it really, truly is an honor. And I'm thankful, that y'all have given me the opportunity to be involved in this community and get to meet all these families.
Yeah, but you're located in the medical office building.
On the first floor, right near the entrance.
Great.
So, and I would love to, see all the families in clinic and get to meet some more members of the community. So thank you for this opportunity.
Thank you again for coming this morning.
Yeah, thank you for having me.